Hello and welcome to Wednesday's workshop. My name is Jake Alsop. I'm an associate osteopath at Kennington, Osteopathy and Physiotherapy. Today I'm going to look at some tips and exercises to help manage shoulder pain, specifically anterior shoulder pain. The shoulder is quite a complex joint. There's a lot of things that can go wrong with it. A lot of things that can cause pain as well. What we're going to focus on is an issue with a muscle called Pec minor at the front of the shoulder. Okay. Just to go over some anatomy quickly and how it works. We have the pec muscle, which is the chunk of the chest musculature here. That's pec major. Underneath that, coming from a coracoid process, so a little point coming from the scapula, the shoulder blade, and from there spreading out to through the ribs, that's pec minor. That's underneath the big pec major. Because it's not actually attached to the humerus like the pec major is, pec minor can cause protraction and basically compression at the front of the shoulder joint because it's pulling forward on that shoulder blade. It's also a breathing muscle, so it helps elevate the ribs when you take a breath in. Okay, and out, it'll depress back down. But if the ribs are immobilized and tight, the pec minor will actually pull the shoulder blade forward and protract it. Okay, so you end up getting this rounded position of the shoulder joint. This causes lack of room in the front and can cause pain in other structures and cause pain itself. So what we're going to look at is how to create some mobility through here, open up a little bit more, and also reduce the tone by doing some direct myofascial techniques. A few things we're going to look at is to strengthen and activate some of the muscles in the back. We're going to look at and also massaging them, basically doing self-release. We're going to look at a muscle here called Serratus Anterior and how to engage that. A lot of the time, weakness and lack of activity in that muscle causes tightness in the pec minor. And then we're going to look at the pec minor itself. So if you have any niggling anterior shoulder pain, this is going to be a great routine for you to try. Let's get started. First of all, I'll go section by section. We're going to look at just getting a bit of the back moving. So all you need to do is get yourself a band and start to work through some external rotation. So for that, there's a few ways you can do it. Arms straight, arms bent. If you're doing your arms bent, make sure you keep your elbows tucked into your sides. Okay? I'm just going to externally rotate our arms, so separate them apart. You can feel free to do this one at a time if you need to. You can attach this to a door handle and just do the one side. Or if you're able to, just do both at the same time to save a bit of time. If it's a bit worse, if your shoulder's particularly bad compared to one of the, I would recommend just doing one at a time. But if not, if you're just doing it as a bit of self-management and self-care, then just go ahead and do both. You're going to do external rotation. Rep scheme doesn't really matter, just do it until you get a bit of fatigue in there. You might want to do it for 15 seconds on, 15 seconds off. And you can do the same thing, give it a bit of slack with your straight arms as well. You're aiming to squeeze the shoulder blades together at the end of the range. And the first one, okay, external rotation. So now we've got the back activated, we can also do some massage through, some self-release through some of those areas. For this, you're going to need to have a trigger ball or a lacrosse ball. Tennis ball might work, it's probably a bit too soft. And some of the muscles we're going to work through are the rotator cuffs. I've been through this before, I'm just going to go over the main ones, okay? So we're going to find the spine and the scapula, which is this bony bit across here. You'll feel it like a line. just going to go below it, okay? So the ball, you're going to feel it and just let it roll off to here. You can do this on a wall or on the floor. If you're on the wall, just lean back into your shoulder. And then you can start massaging through there, okay? You can do big circle movements, or you can find a spot that's really tender, like I have found, and sink into it, okay, and do small ones. You can even start to add a little bit of internal and external rotation from the arm. And go back to a bit bigger, okay? On the floor, on the floor, we can do this on our side. I'm going to take that ball again, pop it into a similar spot, okay? And start working into there. And again, a bit of internal and external rotation. The idea of working in the back is to help release off some pressure and open up the front a bit, okay? And then you can essentially do the same process along different areas of your body. So I was working around here. You can come more into the armpit, get some different muscles, and you can come down into the lat dorsi and the serratus anterior. So you're essentially just working around this whole region. I recommend working here separately, then working here, then working here, and then working here, rather than doing everything at once. Do it in sections. The process would be just to go generally over everything, give it a warm up, then find the sore spots and go in a bit harder. Lock it down and move around the ball. This, if you're feeling up to it, this could last a while. You could be doing this for 5 minutes. Going between hard and soft pressure, going from muscle to muscle, or just lying there while you watch TV. That'll work fine. Once you've worked into the external rotator cuff, we can start going into serratus anterior. It's the muscles across like the ribs basically. You can see it pop out in the ribs. The best exercise for this I found is to do straightest punches. So essentially, imagine if you're lying down on your back doing bench press. You're going to, rather than moving your elbows up and down like you do a bench press, you're going to just keep your elbows locked out straight at all time and just squeeze shoulder blades together and then roll them forward. Okay? That is a serratus punch. You may find it easier to engage this in different positions. So standing up, leaning against the wall with your hands on the wall, lying down like you have dumbbells in your hand, or in a push-up position and your body's moving up and down rather than your arms moving forward and backwards. That would look something like this. Find out which one works best for you and use that position. If it's push-up, then I stick to just doing push-ups. You can do it on your knees to make it easier if you need to. Or you can do it standing up against the wall, leaning into the wall, and then basically just moving your body around your arms. I quite like using a band, and I do this, you can do it as a rehab process with a light band, or you can do it with a quite strong band as a warm-up for training. Around the body, under the armpit. And then let it retract back and round it, retract it forward, okay? That's serratus punch. And again, just do it, rather than for reps, do it for time, maybe 15 to 20 seconds, or until you feel it starts to activate or you feel it starts to fatigue. I want you to be able to achieve about 3 of these, 3 rounds. So if it's too heavy or something's too strong, you can only manage 1.5 or 2. Make it a bit easier for yourself so you can actually achieve all 3 sets. And again, like I said, after you've done that, you can get the ball and work into the serratus anterior, okay? And then let's work into the actual shoulder joint itself. So we've worked along the back and the sides to help even everything out and release it off. Now we're going to work on the pec itself. I'll start off with a stretch, a basic stretch. and then I'll go into myofascial work as well. So for a stretch, we're going to do basically a pec stretch against the wall and just adapt it slightly for it to focus on the pec minor. So the normal pec stretch is to, I'm just going to take a knee so you can see my full body. Just have your arm on the wall. I tend to like to have the same leg forward. And then you just go to lunge into it. Typically you'd be doing standing up, not kneeling. I just do it kneeling for the purpose of the video. So as we know, pec minor, rather than coming from the humerus to the chest like pec major, pec minor is coming from the shoulder blade and it's almost vertical. So to focus on there, what we're going to do is rather than lunging forward, we're going to lunge forward and down, almost like a plane landing, okay? And then our hands are going to be elevated up. It's a bit harder to do kneeling, so you definitely do this one standing up. Okay. And then as you start to hit the stretch, you may want to add a bit of rotation away. So I'm rotating that way. Back to center. And coming out. Alright. Now it's a breathing muscle. So after you warmed it up, after you found the stretch, get in there and then just do some deep, long breaths. And you can move with that breath, try to focus it a bit more and come out. The stretches, you want to do those for a bit longer. I like to start with dynamic stretch. So you're going to start doing your stretches whilst moving in and out. You're not bouncing in it, we're just moving controlled in and out of the stretch. And then you're going to go into a long, deep, static stretch where you slowly increase. That's where you just sit there, okay, and breathe into it. So that's the pec minor stretch. We can try to do some activations, but I found that it's sometimes better just to do the stretching and the myofascial work, but I'll go with some activation anyway. And you're going to be doing stuff very similar to pec major here. I found most of my patients Pec Flies is the best way to engage it. And that would be having the band on your back and coming in and forward, okay? With this, I want you to really engage your shoulder girdle as you're rolling forward and back, similar to the Serratus Anterior when we're engaging that shoulder girdle. We're going to do that with the fly as well. Pinch and round, pinch and round, okay? If you can also make it a bit of a decline. So you attach this to the wall behind you. I can't do that unfortunately, but I'll help you visualise it. Either attach it into a door or around a coat hook above your head, okay? So that when you are doing your double fly, you're actually aiming down. I'm going to show you with my right hand. So this hand is where it's going to be pinned up and behind. You'll basically be going from here to here, okay? So it's a Pec Fly again, except we're starting up high and we're coming down low. And you'll do this with both hands at the same time. So when you do it with both hands, you look something like this. Try to keep everything even as well. So just a point of reference, if I come down here, take Ernest the skeleton's head in the background, it will be attached somewhere up there, about here, and you'll be coming down and forward, okay? Elbows need to stay even, you don't want to have them odd like this, keep them together, and coming down and forward. That's going to help engage pec minor a bit more as well. Once you do a bit of activation, again with the rep scheme, do it to what's comfortable for you. I like to always do 3 sets, it's quite easy, but how many reps you do depends on how strong the band is and how sore your shoulder's feeling. If you're feeling quite vulnerable, if you're feeling quite sore, you want to just take a really light weight and just move through it gently. You might not even want to do the full range, just keep it in a short range. If you're feeling a bit more energetic and a bit less vulnerable, then take it into that larger range and start to increase the reps and start to increase the load, the strength of the band. Once you've done that, we can then start going into myofascial work again. Now this is a really effective move. It's pretty much what we've just done around the back. We're going to show you specifically for the pec minor. It's great for releasing off tight pecs in hunched work postures, causing that anterior pinch. It's great for weightlifting and for gymming. So a lot of people have that dominant anterior chest and less dominant back musculature. So this helps release that off and will help with a lot of shoulder movement and shoulder range. So it can be done on the wall or on the floor. A lot of the time it's demoed on the floor. However, if we're dealing with a painful muscle, we may want to do it on the wall because it's more controlled. If you're coming back if you're rehabbing this from injury, I suggest doing it on the wall to start with so you can get the gist of it. And then when you get used to it, you can start doing the floor because it's less control on the floor and more pressure. So you're going to try to aim for this spot of your shoulder, okay? That's where the pec comes from, about here, pec minor, down to about here. So that ball's going to go there, and we're going to work in this sort of region, up and down. We can also, once we have pressure on, we can add that shoulder movement as well. So it feels against the wall. Just have it in here, and you just lock it in like this, okay? And with your weight going into it, you just start going up and down in the direction of those fibres. So remember, we're going from about here down to here. So you'll be moving in a direction which facilitates the ball rolling along those muscle fibres. Just warm it up, and this is going to be like a massage. It's going to be, if you've been for deep tissue before, it's a bit sore, but it feels therapeutic in a way. Don't go too hard. It's going to be a bit tender. Do it to whatever you can tolerate. And then, what you can also do is lock it in, put a bit more weight through, and start moving the arm up and around. And again, you can do this with breathing. Try doing both ways, so breathing in on the way down, breathing out on the way up. Do that for a few reps, in and out. And then what you can do is swap around, see how that feels as well. So breathe in on the way up, and breathe out on the way down. A way to make the stretch a little bit stronger is positioning. Have that active arm on your back and work into that again, okay? So like I said, this can be done on the wall or on the floor if you're feeling a bit more confident. On the floor, it's going to look something like this. I like to have one leg hitched out. There we go. And just rolling up and down those muscle fibers. I think you can see me there, sorry if you can't. And again, then you can then add in the arm movement as well. Drawing circles. It will be really tender when you first do it. Hence why I said maybe use the wall first. Once you get used to it and you know your threshold, you can crack on and do it on the floor. But that's a really good way to release off the shoulder. It's something I'll give to people doing pec rehab once they're able to achieve that. Say if you're in clinic and you've been to see me 1 or 2 times for like a little tear there, you wouldn't be doing this exercise. It'd be too aggressive. You'd be doing gentle mobilization, some general shoulder stuff rather than specific pec stuff, and we'll be slowly moving into activation with the bands and gentle stretching. Then when you're feeling a bit more confident and the pain's going down a little bit more, you can start doing stronger work with bands and start adding in trigger ball therapy. So just to recap what we've been over, we want to release off a lot of the musculature around the back of the shoulder, including rotator cuffs, on the shoulder blade, in the armpit, so the lat dorsi and the serratus across here. We're going to engage those muscles as well, so that's external rotation with the band, and that's that serratus punch to get that serratus anterior working. That's to basically add a bit of strength and a bit of counter resistance from behind to open the chest back up, okay? The serratus adds a bit more control to the shoulder blade, so we can actually suck the shoulder blade into the rib cage. Then when we have that base there, we can then start to add in direct treatment onto the pec minor itself, which again will be a slight activation, the stretch with the elevated arm, including breathing, and then add in the trigger ball once you've done that whole process. When it starts to get better, you might increase the strength, and some of the exercises might seem a little bit less useful. So you end up just focusing on things like the trigger ball, which is fine. But until then, go through the whole process and try to get some relief in the anterior shoulder. It will take time. Don't rush any of it. The whole routine will take some time as well as the healing process. But give it a shot. Drop some comments below or direct message myself or the clinic if you have any more questions, and see if it helps. Otherwise, have a great evening, and I hope you enjoy trying this out. Good night.